Hey, thanks for joining me for a quick update on long-term care in Iowa. In probably the first real shoe drop since the U.S. Senate Finance Committee hearing on nursing home abuse and neglect last month, CMS Administrator Seema Verma announced in a blog post on Monday that she is undertaking and has ordered a comprehensive review of nursing home rules and regulations across the country. She's asking for $45 million to implement a 5-point plan to review and place newfound scrutiny on regulations for nursing facilities in America. That includes an intensification of CMS supervision of state survey agencies, a, quote, enhanced enforcement to, quote, hold nursing homes accountable for the care that they provide, and addressing, quote, serious quality issues in nursing homes in America. Look, we all welcome regulatory scrutiny. Providers live it every day. Last year alone, providers in Iowa bore an additional $5 million of compliance costs associated with a new federal survey rule and regulation. That tab is going to run to $25 million by 2024, just as a result of that one federal survey rule change. In the face of all that, Iowa providers provided some of the highest quality care in America last year. To suggest that the sector is not highly regulated, intensely regulated, is not a particularly defensible position, in my opinion. Yet, CMS Administrator Verma's position was clear in her blog post. She said more is to come. Last month's hearing, chaired by Senator Grassley, featured wrenching testimony from families who have been affected by abuse and neglect. It was a difficult hearing to watch. It also featured expert testimony that discussed the relationship between Medicare and Medicaid funding and quality outcomes in nursing homes. Simply put, you cannot expect higher quality for less funding. That was made abundantly clear by experts in that room. The hearing also featured robust discussion about real ideas on how to improve nursing home care in America's nursing homes, including an idea to provide access to a national workforce database for providers to root out bad actors and ensure that they don't bounce from one facility to another. Count me disappointed that Administrator Verma's blog post did not include discussion of those points, but simply pointed the federal government's finger at providers and said, we're going to ask you to do more with less. Look, what's to come specifically of her review and Senator Grassley's investigation is not knowable, but what is knowable today is the remarkable quality journey that Iowa providers, nursing facility providers, have been on for a number of years. In 2018, Iowa providers provided 8.5 million days of care for some of our most vulnerable citizens in our state. In 99.8% of those cases, a high-quality, deficiency-free level of care was provided. Better put, 99.8% of nursing facility days in Iowa are deficiency-free. 99.8%. Both short-term and long-term rehospitalization rates are better in Iowa than the national average. We average 15% in Iowa against a national average of 17% of residents who are rehospitalized. And antipsychotic drug use in Iowa nursing homes is down 36% since 2011. Some of the most remarkable improvements anywhere that you'll find in the country. And so, you know, it's important for us all, for providers and the rest of us, to be aware and to follow what's happening in Iowa and America's nursing homes. One way to do that really easily is to follow the hashtag quality care in Iowa for you to see for yourself about the remarkable things that are happening in Iowa nursing homes. Hey, thanks for spending a couple of minutes with me today, and we'll talk to you next time.